The question that I want to discuss today is whether MRD monitoring prior to allograft is standard in AML treatment. And today I want to start that there are several technologies that we use. Every technology has some limitations, some benefits. The major technologies are flow cytometry and RT-PCR, and we are now developing methods with next-generation sequencing to monitor MRD. Although we still need standardization of these methods, we already have good data that suggests that MRD monitoring is helpful in the decision, on the one hand, to choose stem cell transplantation or not in patients with febrile risk and intermediate risk AML, and also to help in the decision how the transplantation should be performed. Now, for the first section, we have the low-risk patients with CBF AML, and there's retrospective data that suggests if you have persisting or rising MRD, the patient benefits from allogeneic transplantation. If the patient is MRD negative, then allogeneic transplantation does not improve the outcome, but rather shortens the survival because of the treatment-related mortality. On the other hand, if you look at intermediate risk patients with NPM1 mutations plus some additional aberrations, then we have French data that suggests that only MRD negative patients should not receive allogeneic transplantation, while MRD positive patients benefit a lot from allogeneic transplantation. So here really MRD prior to allogeneic transplantation helps to identify the best consolidation treatment for the patient. Now, in patients who have a clear indication for transplantation because of their high-risk genetic disease, the question is whether MRD can help to choose the best approach. And now we have one prospective study from China and a confirmatory retrospective analysis from the United States that show that in MRD positive patients, haploidentical donors can overcome the negative prognostic impact of MRD positivity before transplantation. And that could really help us to select the donor approach, and the likely explanation is that alloreactivity is higher in haploidentical patients, and especially MRD positive patients seem to benefit from a haploidentical donor. So this is the current indication and use that suggests that MRD assessment prior to allograft is beneficial and helpful.